Hi folks, Dr. Gus back with you again. Hey listen, last time we talked about several of the risk factors that may put you in a high risk category for developing chronic kidney disease. We're going to talk about kidney function sometime in the future. We won't get too complex. But what are some of the things that your family doctor can do to begin to screen you for high risk profiling in this disease category? Very simple things. There are two tests that I would recommend that all folks who are in any of these categories should have done. The first is a simple urine test. And what we'll talk about in the future is what kinds of things are actually contained in the urine. But one important thing that it should not contain is something we call protein or albumin. And certainly the higher amount of protein or albumin found in the urine, the greater the risk is for the development of worsening chronic kidney disease. So that's number one, looking for protein or albumin in the urine. The second is a blood test, looking for a substance that's called creatinine. And we'll talk about this substance, creatinine, in the future, but it's a harmless substance in and of itself. It comes from muscle breakdown. Each day our muscles are broken down and new muscle forms. So it's a normal process in the body. The kidney is responsible for getting rid of it. So the amount of creatinine measured in the blood can in some instances, in most instances, can reflect the nature of our kidney function. Whether it's functioning well, getting rid of this substance, or whether it's not doing as well as it should and is not eliminating this substance or filtering it properly. So looking at just these two things can give us a lot of information and can begin a search to determine whether or not we are at high risk for the development of kidney disease at all, or whether small amounts, small abnormalities in these two will be predictive that we will develop or have already developed chronic kidney disease. So the next time we meet, we'll talk a little bit more about some of the other tests that might be useful and some of the maneuvers that we can go through to perhaps modify our risk. So until next time, keep your kidneys well.